Good afternoon, Dr. Sutter. How are you doing today?
Good, Drew. How you doing?
Wonderful. So I am already recording. So the CDC is supposed to release their new guidelines today, but I mean, everyone's gotten a sneak peek at them. They're talking about wearing masks for even vaccinated individuals indoors where COVID-19, the Delta variant, is prevalent. What's your initial reaction to that?
Yeah, well, Drew, it's hard for me to comment on guidance that hasn't come out yet. I've seen the public reports that they will announce it, and I think they're announcing it this afternoon. What we know is the Delta variant appears to be spreading much more than previous variants, including the Alpha variant, which was previously our main variant. What to do about that is a bit unclear, but certainly it's concerning that only about 50% of the eligible people in our county are vaccinated.
And then what do you have to say about only half of the county being vaccinated?
Yeah, so it's disappointing. The vaccines are safe and effective. They're free and they're easily available. With smallpox, with polio, really with every significant infectious disease that's had a vaccine, vaccines are what stop it, and vaccines are what stop this pandemic. I really urge all the eligible people who have not yet received their shots to get vaccinated.
Is there any worry that if people don't get vaccinated and the Delta variant becomes more prevalent, that this could morph into something worse than what COVID was, and then the vaccines are really useless at this point, or is that not a concern at this point?
The good news is that the vaccines, the 3 vaccines that are currently authorized in the United States, all have good effectiveness against Delta. It doesn't appear that Delta is a more severe infection, but it just spreads much, much more easily. This spread is largely within the unvaccinated, at least those are the ones being hospitalized. But people who are vaccinated can still get infected. They always could. There have always been breakthrough cases. They're much less likely to transmit, however.
And then lastly on this, Allen County's positivity rate is just like the states. It's continued to just go up. I believe today it was just below 8%. Why do you think why do you think the cases are skyrocketing other than people getting the vaccine? Like, why aren't people getting this vaccine in your opinion?
Yeah, so I think there are 2 things really responsible for our rise in cases, and we have seen about a 6-fold rise in cases over the last month. One of them is that our dominant variant has quickly become the Delta variant, and it appears to be spreading much more easily. And the second is almost everybody's gone back to normal. There are very few masks being worn, distancing is not a thing, and people are tired of being cooped up, so they've been traveling. Um, Basically, the behaviors have returned to pre-pandemic in the face of a much more easily spread variant. Um, this is largely a problem of the unvaccinated, and I'd urge everybody who's eligible to get a vaccine.
Is there any worry that we would go back to what we were in March of 2020, April of 2020, where it was really the height of the pandemic, and then it would just continue to be this ebb and flow for the near future? I mean, for the next 5 years, or is this something that we could truly nip in the butt fast?
So it's unclear exactly what will happen with this spike. We've seen a 600% increase in cases, and that's not totally unexpected. What's more concerning is we've seen a 400% increase in hospitalizations across this region, and that's what we'll be watching closely. Last fall, it was very clear when our cases went up, our hospitalization and deaths were going to rise right along with it. Because of the number of vaccinations that we've had, especially in the over 65, we don't know exactly how that correlates yet. The general feeling is that even with high cases, we probably wouldn't overwhelm the healthcare system. But seeing this rapid rise in hospitalizations is very concerning. We're still not seeing large numbers. The hospitals aren't being strained. But if this curve continues like this, we could end up in trouble.
Is there anything else you'd like to say about the pandemic, the state of Allen County, or just anything health-wise in general?
Yeah, pandemics end with vaccinations and with vaccines. We were blessed to get 3 safe and effective vaccines. In many ways, we got lucky that these vaccines were as good as they were and as safe as they are. There's occasional adverse effects which are serious, but they're far outstripped by any risk of actually getting the virus, really in every age group. So I'd urge everybody who has not yet been vaccinated, who's eligible, to get their vaccines.
Thank you so much for taking the time to speak with me on this, Dr. Sutter. I know we'll be continuing to be speaking with you in the near future on this.
Good chance.
All
Thanks,
right,
Drew.
thank you.